let's start out by getting a little of background information on who you are, your experiences, and things like that. So like I said, I'm looking over your resume right now, and I see that most of your clinicals, if not all of them, were somewhat of a, well, let's see, two of them were in a school, one in a hospital situation, and one in a speech and hearing clinic. So did all of them have a pediatric focus? And then I guess, let me back up and ask you, A, what is your focus going into this? And B, explain a little bit about your clinicals.
Mm-hmm. So I am applying right now to elementary schools.
Okay.
To be a speech language pathologist there.
Yep.
That is where I feel like the most confident in my skills. So then I guess just to demonstrate my experience so far. So we had 2 semesters at the University of Wyoming Speech and Hearing Clinic.
Mm-hmm.
So there, each semester we had 2 to 3 clients. I had one student that was in 2nd grade. He had a cleft palate, and we worked on his articulation. He had a lateral S sound, so we targeted that, and he made a lot of progress. The other clients I had there were more adults or high school age. But then last fall, I was at an elementary school in Cheyenne, Wyoming, for 2 days a week. We took classes for 3 days a week, and then we had our community placement 2 days a week. So I worked with a speech therapist, and we had a lot of kindergartners and 1st graders, and then I think we got up to 4th. We had a few 4th graders, but not that much. So again, more experience with those younger ages.
And just to refresh, your focus, your goal is to be in an elementary school, right?
Elementary or preschool.
Okay.
Yeah.
Okay.
Yep.
Okay.
Yeah. And then I moved back to the Illinois, Indiana area. Mm-hmm. And I had my first 12-week internship. So we're full-time with our supervisor. Whatever hours they do, we do. And so I was at a school in Cherville, Indiana. We worked primarily with preschoolers.
Okay.
Screening, evaluating, and treating them. She did mostly evaluations, but I was able to work with her assistants. She had 2 speech assistants, so I took some of their students. So sometimes I was in the classroom, in a preschool classroom, and then sometimes it was itinerant speech. So where the parents just bring them in for a half hour. Okay. And then we did a lot of evaluations for preschool age kids, and we did some screenings for the community. It's a child find program.
Okay. So you mentioned community placement, 2 days a week at one of your clinicals. Can you explain a little bit more about that? And maybe you did and I just missed it, but
that's okay.
What was that? What did that entail?
Yeah, so we drove to our placement. So I came in, my supervisor had meetings both of those mornings. Mm-hmm. So I think Tuesday we had meetings with just the special education workers her coworkers. Sure. And we had a agenda that we talked about certain students or the psychologist was there, the OT, PT, and sometimes the teacher, depending on if they had concerns too. Okay. The principal, and then I did what she did during the day. So I started out just observing the first 2 days, sure. And then I started taking over her sessions, speaking up more in IEP meetings, presenting to a few parents our findings of our evaluations. So most of it was in a small group setting in her little speech office, and there was 2 we had like an hour in a special education classroom where we had a few different students in there
Yeah.
that we worked with, and then a teacher that we went in during their reading time to help facilitate
Okay.
students reading.
Okay. So, again, looking at your resume, comparatively speaking, you worked Three Rivers. How different was that? What type of approach did you deal with? Well, I guess, who did you see? Who did you work with? And then compare and contrast. Because I'm always curious. It's such a weird time frame. Like you've been working with pediatrics for 4 months or whatever, and all of a sudden, it's boom, you have to switch your mindset and you're working with, all sorts of adults. So I guess, who did you see, who did you work with, and then comparatively, how did that alter your approach to treatment?
It was just totally different. And I was a CNA in high school.
Okay.
So I had some experience working with the older generation, the geriatric population, but not a ton and not any with speech. So it was a lot different, and but it was neat to apply. Those are all my favorite classes in grad school. I really liked learning about that, but it was interesting just applying all that knowledge, and like even just a small thing like seeing a tongue deviation after a stroke, going to the weak side and stuff like that. Like that's really simple, and my supervisor was surprised that I was like excited by that. But
Sure.
I was like, oh, that's the first time I've seen that in real life. I've only seen that in like a YouTube video or
Right.
in a book. So
Right.
yeah, so a lot different, but some similar techniques you can use with adults versus kids, like the hierarchy of like finding what skill they're at and seeing where you can get them through different scaffolding techniques and different giving them positive reinforcement or whatever their reinforcement is, telling them like, well, you'll be able to do this when you go back home.
Right.
The evaluation process, I would say, it's a lot different, but it has so many similarities. You're looking at a lot of different things, but it's still a similar process. It's kind of methodical. You start with your interview, and then you work towards the more specific things that they're concerned about. Treatment, I would say, was the biggest thing that was different, because it's like finances and filling sentences and doing a lot more functional things and like playing games and just like flashcards and things like that. You have to make sure it's functional and that they'll be able to apply what you're telling them when they return home or to their nursing facility or whatever.
Sure. So hearing you talk about that, hearing you talk about how you loved a lot of those style classes back in grad school, why pediatrics? What? It just sounds like you have an overall passion for working with them, but why pediatrics?
I feel like that's where I have the most experience and I'm the most competent. So I liked all the medical classes a lot more, but I think the pediatrics have a lot more diversity within them, and they have. I feel like my day would be just always different, and it's a lot more fun and energizing than working with adults. Not that working with adults is bad, but at least to start out, I feel like I can bring that enthusiasm and that spontaneity.
And I think you're kind of a rarity in the sense. Well, no, I take that back. Like my experience in dealing with people who, when presented with pediatrics, it's always one of two outcomes. One is I love them and I want to work with them, and the other is I love children, but I have no desire to work with them at all. Like I have
Yeah.
my own, and that's where it ends.
Well, and yeah.
So I always find that interesting to hear what makes those who want to work with pediatrics so passionate and why they want to do it. So that's
Yeah.
always
And I one thing if I can add, I
sure.
think seeing adults progress is great, but like seeing the child's progress throughout and like not being able to even understand them to them making such significant gains in their goals was definitely rewarding as well.
So kind of hopping all over the place here. I'm sorry.
That's okay.
With it being your CF year, are you looking for more contract work? Are you looking for more permanent work? What has been your experience, and what are you looking to do going forward?
I'd say more permanent.
Okay.
Although I think a first job, it'll just depend. I know it'll be harder because you have to kind of set your own. So far I've been working with different supervisors, and they all have great ideas and ways of organizing and things, but I kind of have to find my own rhythm. So I'd say like for sure, a year contract, and then depending on how it goes or what else opens up, I'm willing to try something new or
Sure.
whatever. Yeah.
Sure.
But I guess the main thing for me, it depends on like where I get a job, because there's one that I'm applying to that's kind of far away, or it's more of a drive than the other ones that I'm applying to. So if I got in there, I would consider other options that are closer to home, like
Sure.
a shorter commute, even if it was a good experience.
So
Does that make sense?
it does. So
Yeah.
let's kind of hammer on that. Your first job out of school is fairly important, I would imagine. What is important to you? What are you looking for? And I know you've kind of mentioned like you might look at a different job closer to home, things like that all kind of factor in. So I'm curious, what are you looking for, and what is important to you in that first job out of school?
I think a strong support for especially the person that'll be mentoring me is important. I I guess if I was offered a job, I'd like to possibly, if I could, meet the person that would be mentoring me, or at least somehow communicate with them. Because I know everyone has a different supervisor style, and I've had some great experiences, but I'd love to have someone to be able to like brainstorm with, and maybe even like if there's a difficult parent, like be able to talk to them about like how should I approach this, or how should I, you maybe they know them better because every school has a different community, things like that different types of families and cultures and things like that I might not be as familiar with. And then I'd say just like teachers that are approachable and that I can ask them like, oh, how are your students doing? Or can I join you for this part of the day and work with these students, or stuff like that to kind of assist in my job experience instead of just being like the speech therapist by themselves. Because teachers have other teachers to talk to, but often there aren't more than one speech therapist.
Okay. Yeah. And again, like I said, something you just said there kind of triggered a question in my mind. Going back to patient populations and kids that you've worked with, who have been some of your most challenging patients? And then also, what was kind of that approach? Because you talk about a team approach, a well-rounded approach, incorporating PT, OT, speech, parents, and all of those meetings. Who were some of your more difficult, I don't know if difficult, lack of a better term, difficult patients, and then also what was your approach in your clinical settings? I mean, obviously I know, it's a little bit different just because they're learning, but maybe towards the end, I don't know if your supervisor kind of let you take the reins on a couple of things. So if you could just explain a little bit of that for me.
So explain some things that were difficult.
Just some of your
difficult students.
Yeah, well, like I said, I don't like that term.
Yeah.
But more challenging, like a more challenging case that you might have had on your caseload, and maybe if you ran into a couple of barriers, like how did you, because like I said, it's more, I keep hearing from you, a team approach is very important. And so I'm just curious if you got to see something like that, or if you're more looking for that and it's more something that you are kind of seeking out because you didn't get that in your clinical.
Yeah. I'd say with my preschool experience with the 12 weeks that I was at the in Cherville, I experienced a little bit of both. So with one speech assistant that I took over some of her kids, they didn't have a big team approach in their classroom, and the SLP would just kind of do her own thing. And we took some of the kids out of the classroom into a smaller room, and we worked with them there. And I felt like it was harder because we were only there one day a week. It was hard to communicate with the parents to see if they've made any progress. Like we had a student that we were like something's wrong, but I don't know what exactly it is. Is it his language? Is it a language barrier? Because they spoke all Spanish at home. But he wouldn't really say anything in Spanish either. Now I'm not bilingual, but I know some Spanish words, and we were even trying to get him to say different colors and numbers and stuff. And so it was difficult. And I mean, we worked with the teacher, but it wasn't it was difficult to get the family involved and the teacher, and with being there only one day a week for me, it was hard to know really what I was seeing, because every day was, at least what they reported for every day, it was a little bit different, and it was just not consistent. So
so I guess, did you try and outline something with your supervisor? Did you try and remedy the situation? What was your approach to that?
Yeah, we tried to meet together with the speech assistant. We brainstormed a few times with her and the teacher. Now, I wish we could have met with the parents as well, and the grandparents, because the grandparents lived with the parents, and I think they did almost a little more than the mom in that situation. But he came part of the way into my internship too, so it was hard to follow up. The first few times we saw him, it was just well, is he not comfortable with us? Stuff like that too. So I don't know. It was hard to judge, but I wish I could have done even more or been there longer to.
Right. And it's tough. I mean, it's tough too. Sorry not to cut you off, but I would imagine that would be very tough being there one day a week and not being able to kind of dive in all the way. So, okay. So really the last real question I have for you, and then I'll kind of open it up to you. And I will preface that by saying, clinically speaking, that is not my forte. But everything else I can try and help you with.
Well, and most of the questions I have are probably more for a specific job, do I have an office? What technology is available, or what evaluations do you have that I can use, type of a thing.
And I'll say just knowing and speaking to enough people, and I'm sure you know this, but each one is really, really different. I mean, I've worked with speeches who it was kind of everything was given to them, and, they were good to go from day one. And then I talked to others who, I'm having lunch with them at the end of the school year, and I'm like, so how was it? And they're going, I had nothing. I had a broom closet. and I basically created everything from scratch. So
Yeah.
chances are you're going to fall somewhere in between, but it's always good to know ahead of time, like, or it's always good to be prepared ahead of time for the absolute worst, because
Right.
you
Yeah.
never know.
Which, I mean, I think I definitely have a benefit of, I have a lot of resources already that I've been collecting from my various supervisors, or like, what if I could like go to a thrift center and get,
Sure.
you know, kitchen. Like, I've noticed that that gets language out of kids, and it provides a lot of opportunities for different things. And so I have ideas and things that I could do, but yeah, it will just depend on what's there and what's available.
Yep. So, like I said, my last question for you is always the most fun one. And it goes into pay. I mean, it's a little bit different because, again, it's your CF year. And I don't know,
Yeah.
I don't know what your professors or your supervisors are telling you, but I'm always curious to hear, what your expectations are going forward, and then, benefit wise, things like that. What would
Right.
you be needing?
I don't really have a specific number. I've seen a really wide range, so I think that it would depend on what school. Like, I know one that I'm applying to is a lot more well funded, and to be than like other ones that I'm applying to, where I don't think they don't have as many funds, and I doubt it would be as much. So I really don't know.
Okay.
I guess I'd just be willing to negotiate, but yeah, I would like benefits.
Okay.
And one thing I think you're supposed to ask once you're done with, or like offered a job, like about like is it 401k or a Roth IRA type thing, where they put, I'd have to, I don't know exactly how that all works. I'm not the best with that.
Sure. So my company, for example, what we offer our travelers or contract people are, we start everyone, all of my contracted positions are hourly. So, generally the scale starts around, for CF, I would say probably 34, 35 an hour. And then depending on the number of hours and the duration of the contract, we offer a full array of benefits. So we have medical, dental, vision, life and accidental death. We offer, your malpractice insurance. My company also offers a 401k that the company will match up to 4%. So we're I don't know how common that is out there. I know a lot of places will offer that, but that's just the standard package that we offer. Now we also offer, completion bonuses. We have money set aside for continuing ed once you hit a certain number of hours. We have like relocation assistance and things like that. So that's what I know. And then it all just kind of depends on the district, though, really. It's like you said, each one is different because each one is funded differently. And so depending on that, if some might be salaried, some might be hourly. I think a pretty safe, I don't even know that for sure. I don't know what they're offering for a direct hire. So that's why I asked the question, is your school, are your supervisors kind of giving you any sort of idea about that? Or is it just
I
go
I
out
didn't
on
really
your own?
ask.
Okay. That's fine.
Yeah, I don't know. I didn't want to make them uncomfortable or feel like they do ask that. I know my one that worked in the school, she said they have like a chart where you kind of start off your first year. This is how many years you work. Like, the more years you work, you go down. But then also the amount goes up based on your education or like continuing education and all that.
Yep.
And then you kind of just, it matches up.
Yeah, where I used to work, we did a lot of work with educational staffing. And it was very, you kind of had your new grad pay scale, and then your mid, and then your top end. And so that's pretty common to hear that. Again, I think pretty safe, and this is just off the top of my head without any real research in front of me, is probably, I would think somewhere around like 30 an hour is the number I tend to hear pretty frequently from CFs. And then they are looking for that, benefit package. So whether it be a 401k, whether it be some sort of Roth, if you go to work for a nonprofit, a 403b, something like that, just make sure that they do offer retirement. If you can get a company match, by all means, take full advantage of that. And then, any other sort of ancillary benefits. So whether it be the continuing ed, whether it be, I know schools don't do this, but like a traveling company, like my company again, completion bonuses or referral bonuses, you might see something like that. So just as many ancillary benefits as you can find and take advantage of, please take advantage, because that's why they're there.
Yeah. The one for continuing education courses, most of your experience places give help with those, or?
Sorry, you broke up a little bit. For continuing
That's
ed?
Okay. Yeah.
I think so.
Okay.
I know it. I would think so, but I don't know that for sure. Again, it's pretty cliche, but I'm sure it all depends on the district. So whether you have a bigger district, they can probably help you a lot more with continuing ed. I mean, you're going to get your professional development, and you're going to get all of that, the first couple of weeks that you start the school year.
Right.
But yeah, I mean, most schools are pretty good about making sure that, you stay on top of your continuing ed. Now, whether there's funding there, that's the $1 million question, but I'm
right.
I don't know that for sure. I used to, I felt a lot more confident about that answer a few years ago, but
no, not so much.
It feels like with every year that goes on, they're cutting more and more, but I would definitely ask that at the interview.
Have you had people ask about or negotiate, I might apply and they have a cap for their caseloads?
Okay.
Any suggestions there?
For negotiating, sorry, you broke up again.
That's okay. So caseload caps.
Okay, so negotiating that. I haven't heard that too much. Okay. Now, again, I keep saying this, but it's the truth. Like each client, okay, I can only draw on my experience and what I know. And what I know is each client that I have is different in regards to productivity. So whether that be, for example, in a lot of SNFs that we have, it's 85 to 90%.
Right.
You go to home health, it's 5 to 6 patients per day. If it's a point system, it might be a little bit different. So I don't know about that. I've never heard somebody ask about negotiating a cap, but I do get hey, what is the productivity requirement? What are you looking for? If I don't hit that, or if I'm it's 40 hours, what am I supposed to do here? That's a very reasonable question.
Right.
Some weeks are going to be more swamped than others. And if, I'm not saying that this is going to happen to me, but, if crazier things have happened and I'm not hitting my numbers, is there a way to seek out help or assistance? What do we have for that? And then, obviously you don't want to short sell yourself, but make sure you get all of that information going into it, because you don't want to be blindsided
Right.
2 months into it and all of a sudden they're slapping you on the wrist for something you had no idea about. So make sure you get a pretty good idea of what you're going into before you go into it.
Mm-hmm. Right.
um, so any other questions related to things like that?
What about people applying to schools? Someone told me to ask, like, because sometimes they'll put SLPs like on bus duty or lunch duty or recess duty. Is that when uh, during an interview, is that kind of discuss something like that?
um, that's a great question. I know, like, my SLPs have never asked anything like that, and that might be the first of it. But it's a different environment in a school. It's almost all hands on deck. I worked in a
Okay.
school setting for 2+ years, and it was always interesting to hear the staff talk about what they might get randomly pulled into on any given day. I mean,
Right.
so you know, I I think it's something you can ask. I don't see a problem with that. And maybe you could just go into it asking like, "Hey, I've heard stories." Just kind of make it a lighthearted question. Like, "Hey,
Right.
I've heard stories about SLPs getting pulled to do cafeteria duty. I mean, is this a common occurrence here? Do I need to prepare myself for that?" Make it your
Right.
own if that's something you want to do. But
Yeah.
I I definitely don't think that's a regular occurrence. But I could be completely wrong about that as
Okay.
well.
Yeah, that's okay. That was just on someone's like list of things to ask because they
Sure.
were you'd be surprised by the amount of work your caseload's bigger than like a special
Yeah.
education teacher or whatever when they have
Yeah.
like 16 or less and we have more meetings
Yep.
because I don't know. So I don't know. It felt like an awkward question to have to ask like, well, I don't really want to do the work, but will you hire
Right.
me anyway? Or,
Right. Right.
so
Now, and I mean, I think get a feel for the interview when you're in there. You'll get a pretty good idea of how it's going.
mhm.
And
Okay.
I mean, look, my biggest thing when I interview people is I can always tell if you're prepped or not. And so go into it with questions about day-to-day things. Go into it with questions about the school district. Go into it with just anything that you think might be relevant to the job. Because in my eyes, the more questions you ask, it means the more prepared you were. If I talk
Okay.
to somebody and I say, "Okay, do you have any questions?" and it's nope, not at this time. It's always kind of, okay, that's fine, but it also feels like you're just A, not prepared, or B, it's not that big of a deal to you. And to me, that's a major turnoff. But that's just me. I mean, I'm kind of weird like that.
But we
So,
just put up there a little bit. What was B?
oh,
Right.
B is, let's see, what did I say? It's a major turnoff, and you're not
Oh,
prepared.
okay.
So,
Gotcha.
like I said, I'm weird in that sense. Like, it's just I would rather you be over prepared than under prepared,
Hmm.
obviously, because again, I'm only getting 30 minutes to an hour with you, and I have to make a decision based off of that. And if you're going into that initial meeting what feels like completely
You
underprepared,
just paused again there. Sorry.
oh, okay. Um, I don't know if there's
Sorry.
like a million people that just hopped
Maybe.
on the wireless network or what, but basically what I was just saying is if you're going into that meeting and it feels like you don't care, it kind of raises an obvious red flag for me. Like, well, if you're
Right.
not preparing for a first impression, how are you going to prepare for whatever the job may be down the line? So,
Right.
but that's just
Yeah.
me. I'm a little bit different in that aspect. So, but do you have any other questions?
Any feedback you have for me?
You were great. The only thing that stood out to me that felt, because I could tell, at the beginning you were a little bit tense. Are you getting this, or did it break up again?
Nope,
Okay,
I can hear you.
okay. You were a little bit tense, and you said in one of your first answers was, "This is to demonstrate my knowledge," and that's a very almost rehearsed, if not, I don't know. It just isn't something you would say in a normal day-to-day conversation. You know what I mean? That was the only thing I noticed.
Okay.
After that, you started to get and it's obvious. It's the first 5 minutes of an interview. You're going to be way more tense. As it went on, I could tell you started to hit your stride. I'm getting a little bit more
Right.
lax. By the end of it, it was very conversational, and so that was the only thing. And I mean, I'm nitpicking, but
Yeah. No, that's good. That's why I practice, so
that
it's good.
that was the only forced thing that came out. So other than that, yeah, I mean, keep it very, very lax, very conversational. Obviously, be professional, be prepared,
Right.
but
Yeah.
again, I go into these things looking to talk to you because you can tell me everything I want to know. And the dirty little secret behind these things is that 9 times out of 10, I already know the answers you're going to give me. So
Right.
I'm looking for things that I don't think I'm either going to hear, or I'm not looking for, or I just don't know.
Right.
But you do this long enough, you kind of go into these things with a pretty good idea of how it's going to go. And then it's always fun when I can have just a real conversation with somebody. So other than that, yeah, you were great.